Hi, my name is Dr. Ayesha Rehan and welcome back to my channel. Today we'll discuss rotator cuff tear and frozen shoulder. The significant difference is that while a rotator cuff tear may still permit some independent arm lifting, a frozen shoulder typically involves most wear, immobilization, and stiffness. We can explain this in a way that a rotator cuff tear often results in pain and weakness, but may still allow for some range of motion. In contrast, a frozen shoulder generally involves a much greater degree of stiffness and limitation of movement, often making it difficult to move the shoulder at all without significant discomfort. The primary issue is the loss of range of motion due to the stiffness rather than just pain and weakness. Movement is considered restricted, often leading to difficulty in performing simple tasks. Additionally, frozen shoulders typically develop gradually without a clear cause and may be associated with age related degeneration and chronic systemic conditions, such as diabetes or thyroid disorders. On the other hand, symptoms of torn rotator cuffs can result from the sudden injury or repetitive motions and stress on the shoulder joint. Frozen shoulders typically develop gradually and can be associated with the age-related degeneration and chronic systemic conditions. They often present with a stiffness and pain that gradually worsens over time, leading to a significant reduction in the range of motion of shoulder. In contrast, torn rotator cuffs usually result from the sudden injury or repetitive motions and stress on the shoulder joint. Symptoms of a torn rotator cuff can result from a sudden sharp pain, a snapping sensation, weakness in the arm, and the difficulty lifting or rotating the arm. Repetitive overhead activities, heavy lifting, or direct trauma to the shoulder can contribute to the development of the rotator cuff tear. Frozen shoulder is more likely to occur in the people over 40, while rotator cuff injuries can occur at any age. Frozen shoulder, also known as adhesive capsulitis, is more likely to occur in the people over 40 due to the combination of factors including age-related changes in the shoulder joint, decreased elasticity of the shoulder capsule, and a higher prevalence of the chronic conditions such as diabetes and thyroid disorders, which are the risk factors for developing a frozen shoulder. The exact cause is often unclear, but it typically develops gradually and is characterized by the stiffness and pain that progressively worsens over time. Injuries, on the other hand, can occur at any age because they can result from a variety of causes, including acute injuries and repetitive stress. Younger individuals may experience rotator cuff injuries due to the sports activities, accidents, or heavy lifting, while older individuals may develop these injuries due to the degenerative changes in the tendons, making them more susceptible to the tears even with the minor trauma or the overuse. Thus, while frozen shoulder is more common in older adults, rotator cuff injuries have a broader age range due to the diverse mechanisms of the injury involved. A frozen shoulder often comes on gradually while the rotator cuff injuries tend to happen suddenly. The frozen shoulder typically develops slowly over time. The exact cause is often unknown, but it can be associated with the prolonged immobilization, surgery, or systemic conditions like diabetes. Cuff injuries often occur suddenly due to the trauma or overuse. They can also develop gradually in case of the wear and tear over time. The symptoms are sudden sharp pain, especially with the lifting or reaching movements, the weakness in the shoulder, particularly when lifting the arm, pain at night or when lying on the affected shoulder, and limited range of motion but often not as restricted as with the frozen shoulder. Finally, some frozen shoulder cases improve with time, while some rotator cuff injuries may require surgery to heal fully. Many cases of frozen shoulder improve over time, even without formal treatment. The condition often resolves on its own, but the process can be lengthy, ranging from several months to a few years. Injections and manual manipulation under anesthesia can help manage symptoms and improve range of motion. The rotator cuff injuries can be managed with physical therapy, rest, medications, and corticosteroid injections. Where rotator cuff tears, especially complete tears or cases, don't improve with conservative treatment, which require surgical intervention. Surgery can involve repairing torn tendons, removing damaged tissue, or addressing structural issues.